Parkinson's disease can be very confusing to the not only the patient but also to the caregivers. The person will be fluctuating in his activities, attitudes and energy levels from different parts of the day, and suddenly they can sink without any energy, which makes quite often the caregivers suspect the malingering or is acting. So that creates a conflict within the family. It should be understood that these fluctuations are absolutely common in Parkinson's disease. Unless the caregivers understand the disease patterns, disease profile, these fluctuations and fluctuation in the drug response, it is very difficult to treat them. So quite often the conflict happens between the patient and the family, that either the symptoms are genuine, and in reality all of them are genuine. There is fluctuations in the disease itself, the motor activity, fluctuations in the drug response, fluctuations in the complications, everything changes. So this can be confusing terribly to the family. So it is very important that we educate the family about the basics of the disease, so they understand about the illness a little bit, what to do and what not to do, how to deal with this kind of fluctuations, not to get into conflict, controversies, which can lead to arguments and depression unnecessarily, which is very, very important. The moral support and the social support one gets in this disease is absolutely essential and unparalleled to the medical treatment, because that is the one which sustains them for the longer years of life. So this need to be understood very clearly, and how to deal with each of these disease fluctuations, the therapy fluctuations, complications and the emotional fluctuations, and treat them accordingly so that everyone can live in harmony and happiness.